Hi, everyone. Today I'm here with Dr. Hoar from Buffalo, New York. He's a Palmer Chiropractic College, Florida graduate and practiced in Florida and now Tennessee. Dr. Hoar was an injured baseball player with debilitating hip and lower back pain in college. After an exhaustive search, he found himself in a chiropractor's office and found the relief he was seeking. After that experience, he knew what he was destined to do in helping people get out of pain and improve their overall physical health. Dr. Hoar is married to Dr. Megan Jack and has two active little girls. For more from Dr. Hoar, you can visit him at his website, www.mobility-forlife.com. So, Dr. Hoar, thank you so much for being a part of this interview.
Absolutely. Thanks for having me.
And so, what exactly is chiropractic and what are the different specialties of chiropractic?
So the first thing is that there are only two words there. There's chiropractic, and then there is a chiropractor. And so what we're doing, we're practicing chiropractic. And basically what we're looking to do is get people out of pain and improve their overall physical function in a natural way, meaning, we certainly don't use any prescriptions, no drugs, no surgery, anything like that. Our favorite tool is a manipulation that we like to use on joints, and that has an inhibitory neurological effect on people's motor processes and sometimes their pain processes. So we get to decrease pain a little bit, improve people's overall movement and neurological control of their body so that they can, get out of pain, improve overall physical health while reducing the need for medications and prescriptions, as well as surgeries and that sort of thing.
And what are the most common cases you see in chiropractic?
For sure, it's low back pain, neck pain, and headaches are the top three that we see. I kind of specialize, you would call me a sports chiropractor. So I like to do shoulder injuries, shoulder pain, knee pain, plantar fasciitis, all sorts of stuff. But for sure, low back pain, neck pain, and then headaches are probably the top three.
Okay. And what is the scope of practice of a chiropractor versus other healthcare professionals? Like, let's say a primary care physician, a PM&R physician, a physical therapist or a massage therapist. What's the different scopes of practices in those?
So we are a portal of entry provider, meaning patients can come directly to our clinics. They don't need a prescription from anybody. You're not going to get any drugs from us. You're not going to get prescriptions of any kind. And then we do have the ability to diagnose particular conditions and injuries. And then we do the manipulation, therapeutic activities, therapeutic exercises, some manual therapies, that sort of thing. But, we certainly, majority of us, we're not doing blood labs. We're not doing the prescriptions like I mentioned earlier. We kind of focus on the physical condition and what can we do to get rid of it. I think that answers your question, maybe.
So besides the couple of conditions that you mentioned previously, what can chiropractors treat? And then what needs referral to some other kind of healthcare provider?
Let's take Susan. Okay, Susan comes in because she was shoveling snow. We're here in East Tennessee, and we got a nice snowing over Christmas, and we don't get a lot of snow here. So Susan's shoveling a lot of snow, and she hurts her back. She doesn't know what to do. Probably a friend or a family member says, go see my chiropractor. I swear by him. So they come into my office. And what we're going to do is a physical examination that includes range of motion testing, muscle testing, deep tendon reflex testing, some x-rays, and we're going to try to see, hey, what's going on here? What did Susan do to her back? Do we think maybe it's presenting more like a disc, maybe a bulging or herniated or a deranged disc? Might it be a facet syndrome? Maybe she's dealing with sacroiliac joint dysfunction. Maybe it's just a postural disorder. That sort of thing. So we're going to try to figure out what is the pain generator. And then we're going to see if there's anything we can do from a chiropractic perspective, meaning we do have massage therapists in our office, as well as the chiropractic adjustments to decrease the overall pain levels and improve her overall kind of motor control going forward, so that not only does it get her out of pain, but it reduces the likelihood that she's going to have that happen to her going forward. But let's say Susan comes in for a round of treatment, and we probably treat her 2 to 3 times for 2 to 3 weeks. And let's say she is just in 10 out of 10 pain, and she cannot live her life. She's not going to work. She's not able to fold laundry at home, and her just activities of daily living are just terrible. And it seems like after our 7 or 8 visits, it just isn't quite making the difference, which doesn't happen all that often, to be honest with you, but it will happen here and there. So if that person is not responding to care, then there's 2 options. We could either decide we want to get an MRI to see exactly what's going on here if we don't have clarity on what the condition is, or maybe if we have a trusted professional, either a neurologist, a spinal surgeon, maybe orthopedic doctor, whoever's most related and whoever has a good relationship with me, can I send this person to that I trust will give a good evaluation to and isn't going to jump right into surgery. That's a fear of mine when I refer a patient is, look, are you going to try to do conservative methods like an injection, maybe some physical therapy, or are you going to just jump right into surgery? That's a concern of mine. Having said that, there are exceptions to that. Of course, I remember I referred to a great neurosurgeon when I was back in Florida, and the patient had drop foot sign, meaning they just had no control of their foot at all. And he really felt like it was necessary to jump into surgery the next day. In that instance, I completely understand the symptoms did show that it was necessary to go right into it. So that's kind of what it is. Every now and then there will be a patient that comes into me, especially here in East Tennessee, where they seem to be having GI distress or just something that just doesn't seem like it's physically natured condition where I'll say, I think you really need to be talking to a ear, nose, throat doctor, or you need to be talking to your primary care physician. I'm not a cardiologist. I'm not a heart doctor. So there's lots of things, especially here in Tennessee, that will present in my office where I love to lean on the medical profession and say, like, this isn't a disc issue here. This isn't a joint issue. I think you need to go see a medical professional.
In terms of the role or where chiropractors fit into kind of the healthcare setting, you'd say it'd be a primary point of entry into the healthcare system, maybe for diseases that are more early on in the disease process, not like where they need to go into like an ICU or something, and then maybe more focused on musculoskeletal issues. Would that be right?
Oh yeah, for sure. Most of the people that present to a chiropractic office still have their activities of daily living. They are not in an emergency situation. If you're fighting life and death, if you're in an emergency situation, you probably shouldn't go to a chiropractor. That's not our wheelhouse as far as what we can help you with. Earlier on in the events of life, when you're dealing with spinal pain, or you notice an inability to move around as well, maybe you're having a peripheral neuropathy, that sort of thing, we can help with that. But yeah, when it comes to emergency situations and life-threatening situations, that's not really up the chiropractor's alley.
So what is the specific methodology of chiropractic care? How do you approach treating a patient?
So I want to take that back to kind of the story you were mentioning earlier. Now, as you mentioned, my name is Scott Hoar, last name Hoar. It's a fun last name. We run into lots of fun stories in my family. But I remember back when I was 8 years old, and I was sitting in my grandmother's living room, and a bunch of my aunts and uncles were sitting around, and everybody was ragging on each other because as they would stand up from a couch to go into, say, the kitchen or another room, they had that walk. Do you know what I mean? Where it's like they're not exactly standing up straight. They're kind of bent forward and shimmying versus just standing up straight and having good quality movement. And they were all making fun of each other and kind of saying, well, after 40, if you're a whore, you don't stand up straight anymore. And I'm 8 years old, and I'm just horrified at seeing what's going on, because it seemed like everybody in my family, the older they got, the more likely they are going to have back surgery, they're going to have knee surgery, they're going to have shoulder surgery, their waistline's going to expand, they're going to be using walkers, and nobody was standing up straight after the age of 40, which, that's not even old. So I was horrified by that. Okay, so fast forward, I was a baseball player in high school, and I started noticing some pain that I was having in my lower back and my hips. The more I would swing, the more I would throw. And it kind of got worse and worse. And I went to college, and it wasn't getting any better. And it was just awful. So what did I do? I went to the primary care doctor. He told me, baseball's not your sport, son. And as a Division I college athlete, that's just the wrong answer. All right. So he didn't exactly give me what I wanted. He gave me some anti-inflammatories and referred me to physical therapy eventually. So we went to the physical therapist, and the physical therapist did some ultrasound, gave me some stretching exercises, and it probably did provide a little bit of relief. But it kind of came right back whenever I would go right into my baseball activities. So then I found myself in an orthopedic office, and they did an MRI, and they kind of said, nothing's wrong. Everything's fine. So I felt like I had hit the end of the wall. I didn't know where else to go. And the athletic trainer at my college at Radford University said, hey, you know what? We've got a chiropractor that comes and treats the athletes once a week. How about I schedule an appointment for you? And I thought, I don't care. I mean, I've got nothing to lose. I'm dying right now. Right now, I'm sleeping by laying on my back on the floor and elevating my legs onto a bed. I couldn't swing. I couldn't throw. I was desperate to try anything. So I said, sure. And this chiropractor, when I eventually went to see her, she could feel how my hips and my pelvis was not moving in a normal way. We call it a joint restriction, particularly in the pelvis and the lower lumbar areas is what I was dealing with. And what she did was she laid me on my side and did a spinal and pelvic manipulation, which is a quick high velocity, low amplitude manipulation of that joint. And what that did was it had an inhibitory effect on my pain processes. I remember walking out of that office. I heard a big crunch, a crack. It was kind of painful in the moment, but instantly I felt way better and lots of relief in my condition. And I stood up straight after I got off that table. I felt like $1,000,000, and my pain had really kind of resolved. I did get 2 or 3 more treatments after that, which helped to reinforce good movement and keeping my pain levels low. But that kind of corrected it. And I just remember thinking, that was awesome. I walked into a room, somebody put their hands on me, did something, and then I walked out of that room and I felt like $1,000,000. And that's what I knew I wanted to do that going forward. So that's kind of what had me. I remember I went and I changed my major the next day from criminal justice to sports medicine, because I wanted to be that guy that you walked into a room, you didn't feel good, he put his hands on you, you left the room, and you felt like $1,000,000. So that's kind of what we do. Back to your question, what are the methodologies? Manipulation. That's a big part of it. But I will say how I differ from some of my other chiropractic colleagues is after I do a manipulation or after I do a manual therapy, say to soft tissues, if you have muscles that have high tone levels or are overly active, you do a manual therapy to kind of bring down the overall activity levels and loosen that area up and restores some of the balance to that segment. And then as soon as you've restored that balance to the segment, then we're going to go do some exercises. We're going to start restoring more normal motor patterns, AKA your posture, your stability, your control, your balance as you move your body, so that not only did we get rid of your pain, but we're actually improving your overall physical health so that this sort of condition doesn't just come back.
You mentioned some of the general manipulations and things like that chiropractors use. Are there different types or different methodologies behind it? Because I see some chiropractors use different techniques or tools online like even for like neck manipulations, like Y straps or other things like that. What are there different like categories that are supported by different organizations, or is it different schools of thought, or
Yes, yes, and yes is my answer to that question. I will tell you, majority of chiropractors focus on spinal manipulations. That's basically where you take any particular joint to its end range, and then you put a little impulse into that, and that moves the joint to what we call the periphysiological space. Okay, it's the exact same thing you do when it's not going to make a noise. When you crack a knuckle, right? I moved my joint to its end range of extension and then put an extra little force into there. And then there was a release and there was a pop. And that's what a manipulation is. I will tell you, I kind of specialize in not only doing the spinal stuff, I also do extremities. So shoulders, the AC joint, the sternoclavicular joint. We're talking elbows, people dealing with tennis elbow and golfer's elbow. Knees, I love doing knees. People that are dealing with meniscus issues and they don't want to have surgery. There's awesome manual therapies that can be done to help out with knees. The Y strap that you brought up, that's very interesting. And I'm going to tell you, it is not widely agreed upon in our field that is a good thing. It's a pretty new manipulation that we've been seeing in this modern age with the TikTok and YouTube and Instagram and Facebook and all that sort of stuff, which, I'm a part of. I have my YouTube channel where I do manipulations. I was never taught a Y strap manipulation in school. And my understanding as a chiropractor legally, I'm not allowed to use any procedures or methodologies that are not taught in a chiropractic college. I'm not familiar with the Y strap adjustment being taught in any chiropractic college, and I could be wrong about that. If one of your viewers is better informed about that particular procedure, I would love for them to write a comment below or maybe email me and let me know. But I'm not sure that is an entirely safe procedure. And for the listeners here that don't know what a Y strap is, basically they'll tie a rope or a towel around the neck and do a very violent Y-axis traction manipulation. And it looks just crazy, which is probably why it gets all sorts of views on YouTube and Instagram and that sort of thing. But I'll be very interested to see, it's not unlike these COVID vaccines. It's such a new thing that we don't know the long-term consequences of that manipulation, the benefits. It might turn out that it's one of the more innovative, awesome manipulations out there. It might turn out that it's causing hypermobility of the C1, C2, C0 vertebrae up in the neck, which would be a terrible, terrible thing to be doing. But we'll see. I don't know.
You talked a little bit about why you became a chiropractor. What was your specific path to becoming a chiropractor? Did you take time off before a chiropractic school, or how did that
Sure. So I was pretty lucky given that I had my come to Jesus moment with my chiropractic career as an 18-year-old. I was a freshman at school. So what I did was I switched the major to sports medicine, and that aligned me to have all my the necessary prerequisites. So your physics, your chemistries, organic chemistries, that sort of thing. So that once I got my bachelor's degree, and these days you do need a 4-year bachelor's degree before you apply for a chiropractic college. So I pretty much only took a summer off in between undergrad and chiropractic school. Now, the interesting thing about chiropractic school is that for the most part, we're all private schools. That's at least here in America. I believe in Canada, it's a little bit more progressive. But, chiropractors, we don't have, I'm going to say, mainstream medical or allied healthcare professional acceptance yet. So chiropractic schools are private institutions, and they're just chiropractic schools. The majority of them don't offer other degrees and other programs. The one I went to is called Palmer, Florida. It's just south of Daytona Beach, Florida. And it's It's just under a 4-year program. It's one of those things you do go to school year round. So it kind of condenses all the course content in a little bit of a shorter time frame. But yeah, 4-year bachelor's degree. And then the doctorate of chiropractic is my technically my degree. So I am called Dr. Hoar. And, then you're going to bring up the whole, are they really a doctor? They're not really a doctor, that sort of discussion, which, the older I get, the more I realize it's not unique to chiropractic. That's the same thing people say about PhDs. It's the same thing people say about dentists, you name it. And then, MDs make fun of other MDs too, right? Like surgeons make fun of ER doctors who make fun of primary care doctors. So, it's all, I take it all as good fun, but that's my degree, doctorate of chiropractic. And then once you finish your doctorate of chiropractic, then you take your national boards. There are 4 rounds of these tests, and then you do a physiotherapy, so kind of a 5th round. And once you pass that, then you're eligible to apply for licensure in whatever state you're in. So at this point, I've had licenses in the state of New York, where I thought I was going to practice, but I didn't. In Florida, where I did practice for about 10 years. And now I have my license here in Tennessee, which is where I'm practicing.
What's a typical day in the life like of a chiropractor from when you start to when you leave?
So the way my life goes right now, say tomorrow, I will get to the office at about 6:15 a.m. And then I'll do notes. I'll do my clinical notes. I'll be writing up x-ray reports, looking through recommended treatments for patients, so that when I start seeing patients at about 7:15, that I'll be ready to go and I've done all the homework that I need to do. So I'll start seeing patients 7:15, and then we treat till about right about noon. I have a lunch break till 1:30, and then back to treatment from 1:30 till about 5:30, and then we're done. Chiropractic is kind of interesting. The average patient that comes into a chiropractic clinic, it's not just one treatment. It's not just 2 treatments. Typically, you would do in a course of treatment. So that's anywhere from 2 to 3 visits for 2 to 3 weeks to really get your initial impression of how well are you going to respond here. So the average chiropractic patient doesn't just do 1 or 2 visits. They'll come in for a course of treatment. So 2 to 3 visits for about 2 to 3 weeks. And then at the conclusion of that initial course, you really know, is the patient responding? And what do we need to do to make sure we have great recommendations to support them going forward? So because you need to go to a chiropractor multiple times per week, we really work hard to make our schedule acceptable to your average person, meaning we got to open up at 7:15 so you can get in to see us before you go to work. We have a shorter lunch break so that patients that are working can come see us on their lunch break. And then we stay open till 5:30, sometimes even up to 6, so that people can hit us after work as well. I feel like, my wife is a plastic surgeon. And when people set up a consultation or an exam with her, they're going to take time off of work. If they need to get a babysitter, they're going to get a babysitter because they know this is a special time. So you can see patients as a plastic surgeon at 11 a.m. or 2 p.m. or whatever it is. Chiropractors, our busy time is 7:15, 7:30 in the morning, right around 11:30, 1:30, trying to get that lunch crowd, and after lunch, so the 5:30, 6 o'clock as well. So it's a pretty long day. And the way the clinic is where I'm at now, I have Tuesdays off completely, and then I have Thursday mornings off. So Thursdays I work from about 1:30 to 5:30. So the days we are in there full time, it's a very long day. But it's nice that, I'm off on weekends, I'm off on Tuesdays, I'm off Thursday mornings, so I can, live a manageable life.
What's the most challenging aspect or aspects of chiropractic?
Not unique to chiropractic. It's stuff like small reimbursement from insurance, from third-party providers. Because what ends up happening, like here in Tennessee, I'll give you an example. if a patient comes in with low back pain, there's so many great things we can do to help them. We can do a spinal manipulation. We can do a extremity manipulation. Maybe adjusting the hip is going to help improve movement and take stress off the lower back. So you would call that an extremity adjustment. Maybe if I do a myofascial release of, say, a hip flexor, like the psoas muscle or the iliacus, or maybe the piriformis muscle, a manual therapy procedure like that, that might make a big difference as well. Or maybe that patient's going to respond better to, say, massage therapy. Maybe that patient's going to respond better to therapeutic exercises where we do corrective exercises to improve stability of that lower back. Maybe that patient's going to respond better to laser therapies. Maybe they're going to respond better to intersegmental traction, roller bed, or a hydrotherapy bed. Or, we've got traction units, decompression units. What I just listed, I know it was long-winded, was about 9 different procedures. The reality is that insurances are not going to reimburse for 9 different procedures, even if every single one of those procedures would actually make a difference. So now I have to alter my treatment based on what's going to be most effective to get that patient's condition better, what is going to make the patient happy to where they'll choose to return without running up their bill too much. So in the state of Tennessee, Blue Cross Blue Shield made a decision that they're going to cap a reimbursement for any particular chiropractic visit at $60. So now I'm going to say modern business of chiropractic in Tennessee is messed up. Because Adnan, if you come in to see me with low back pain, you're going to want me to do a full examination, correct?
Mm-hmm.
Yeah. Okay, that's one procedure. That procedure's reimbursement rate is probably about $50 in Tennessee. You'd probably want me to take some x-rays so I know if you have any fractures, any tumors, any infections. Would that be correct?
Mm-hmm.
Okay, that's another procedure. The bill for that's probably going to be $70 to $80. Then you actually want a treatment so I can actually get you better. Would you want that?
Yeah, of course.
Yeah. So then I'm going to do a spinal manipulation. Reimbursement for that's probably $30 or $40. Maybe you say during that visit, you know what, my muscles are really tight. I think it's the muscles that are causing the pain. So now you want me to do a manual therapy or a massage to those muscles. Okay, now we're over $250, right? The thing is, Blue Cross Blue Shield for that visit is only going to reimburse us $60. So the realities of business, of life, of logistics is a business owner is not going to want you to do things that waste time and waste money, because I've got other patients that are waiting on us that are in just as much pain as you. And if I'm wasting my time, I'm doing a bad thing for my business. So now Blue Cross Blue Shield is making the practitioner and the business owner pick between, are we getting paid for our efforts or are we wasting our time? So that's awful. That's a huge frustration for me, because I'll tell you, if you come in with low back pain, I want to give you some exercises. I want to give you a spinal manipulation. I want to get your hips moving. I want to treat your muscles. Anything I can do to help you, I would want to do. And Blue Cross Blue Shield is taking that out of our hands. And it's frustrating as a educated, trained practitioner to have a third-party money-making insurance company dictating my practices that I get to deliver to a patient that's in need.
And on the flip side, what's the most rewarding aspect of being a chiropractor?
It's keeping people from having surgeries. It's restoring health, happiness, livelihood, physicality to their lives. I can't tell you how many people have come in. They say, like, let's see, I had this the other week. A patient came in, she had shoulder pain, and she says, I've got frozen shoulder. I've got an appointment to get shoulder surgery in 6 weeks, and I'm just devastated about it. She couldn't raise her arm over her head. She couldn't pick up her grandchild. It was awful. And I said, I tell you what, what if we could actually help with that? She said, sure, I'm down for anything. She comes in, she does her course of treatment, and she was able to cancel her surgery appointment because we were able to get her pain levels down, restore normal range of motion to her shoulder and normal function. So now she's playing with her grandkids. She's putting a dumbbell over her head. You know, she's doing all sorts of great physical stuff that we were able to help her out with, that really she didn't have a lot of high hopes going into the treatment. So that's the best part. A person walks into your room feeling bad, I get to do something, and then they leave my room a couple minutes later feeling awesome. That's awesome.
What are the misconceptions or some of them about chiropractic?
Oh, gosh. Misconceptions about chiropractic. Well, one that we brought up the other day was once you start going to a chiropractor, you're always going to have to go to a chiropractor. And I kind of laugh at that. It's kind of true. But that's like saying once you go to a dentist, you're always going to have to go to a dentist. And it's like, well, yeah, I really hope, Adnan, that you're brushing your teeth today. I hope you did some flossing today. I hope you're staying away from sugary foods. And I hope you have an appointment to see your dentist in the next 6 or 12 months, right? Nobody complains about the fact that they have to ongoingly support their oral hygiene, the health of their teeth, by going to see a dentist, by on the daily basis taking actions that are going to help the overall health of your teeth. And that's what a chiropractor does. A chiropractor checks to make sure you don't have any imbalances in your movement, in the vertebral segments, in the joints of your body, and the muscles of your body, to see, hey, are you doing well or are you not? If you're stiffer than you should be, say, in your hips, it might not cause any pain. And if you continue to live life for 6 months, a year, 4 years with stiff hips, eventually what's going to happen is your pelvis and your lower back are going to start to move excessively and inappropriately. And there's going to be shearing forces in how you move because your hips are too stiff. And now your lower back is going to move too much. As a result of that, you're going to set yourself up for pain, injury, and decreased health and activity going forward. So the recommendation is, yeah, come in and see me once a month. If you think that sounds too much, come in once every other month, come once a quarter. But I do recommend that patients ongoingly address the imbalances of their body so that they're set up for decreased pain and improved health going forward. Have you heard that one? Once you go to a chiropractor, you always got to go to a chiropractor?
Yeah, I've heard some people mention how chiropractors, or some of them, tend to maybe, they say, string you along for like more sessions than some people feel are necessary or things like that. So I think that's kind of in line with what you're saying.
Well, you know what? But I think there's also some truth to that. I think some practitioners do see patients more frequently than they really have to be seen. Just like any profession, we have good apples and we have bad apples, right? Part of that is just a lack of integrity with that particular practitioner. Also, part of that is Blue Cross Blue Shield is limiting your reimbursement to $60 per visit. So you need to see so many visits to keep your lights on, to pay your staff, to pay your student loan bill, to pay for the mortgage of your house, you know? So it's unfortunate, but it's true that I do think some people are doing treatments that they don't need to do in order to line their pockets. But that's not unique to chiropractic. Mm-hmm. I mean, my financial advisors do that. Other medical practitioners do that. That is, people jumping into surgery that you don't need to necessarily have because, you know what, the surgeon's going to get a big payday out of that. That's part of what we run into with America's medical system. Are we doing necessary medical intervention? Are we not? The problem with insurance companies and reimbursement, the way it is a lot of medical professionals are doing procedures that they don't need to be doing because they make more money from it. Mm-hmm. That's not unique to chiropractic, But yes, we deal with that as well.
Of course, there's going to be individual variability, but there are different groups that maybe, let's say, podiatrists or ER doctors or primary care physicians who notice trends in their field where there are certain things that they do well and certain things that could be improved upon. Do you feel like in chiropractic, there is maybe like a range of things that chiropractors do really well that you feel, and then areas that could be improved on?
I think we do really well with spinal pain. I think we do really well with neck pain. I think we can be very helpful with lots of hip issues, with a sciatica, a hip impingement sort of thing. I think we do well with that. A couple of areas that we don't do great with, but it opens the door to your earlier question of when do you like to refer out, is people that are having let's say migraines too much and they don't seem to be responding to that initial course of treatment. Well, we need to find another practitioner that does better with that. I have a great relationship with the pelvic floor physical therapist out of University of Tennessee Medical Center. I love referring to her because you know what? After if a female just had a baby or whatever, and they're having pelvic floor issues, well, that's not a great. Chiropractors, maybe some manipulations to the hips, to the lower back, maybe that can help out a little bit, but it's also not our expertise. So when you say, what are some things we don't do well, as far as conditions treated, I think it's fine that we don't treat some conditions well, because that's when we get to share the load with other practitioners, pelvic floor therapists, ear, nose, throat doctors. When people have vestibular issues in their ears and it's causing dizziness or vertigo, sometimes chiropractic can help with that, but sometimes it doesn't. So that's when it's great to have your network of trusted professionals to refer to.
Why do you feel that is, that the public seems to be a lot more comfortable in general, from what I've seen, with chiropractors as their first point of entry into the healthcare system? And do you feel like there are areas that physicians like MD and DO physicians could improve upon to better gain that trust of the public?
I would disagree with you that on the grand scheme of things, people trust their chiropractor more than they trust their primary care physician or other mainstream medical, because I think 9% of America goes to the chiropractor. So I'm pretty sure it's a lot higher than 9% of people that go to a primary care or an internist or that sort of thing. But I will speak to, there is a percentage of people that like their chiropractor, they trust their chiropractor, they have a personal relationship with their chiropractor, and they know their chiropractor is going to listen to them. And so they like to turn to that person because probably that person has had some negative experiences with a primary care physician. Because a primary care physician is, maybe they're spending not enough time in the room with you. Maybe the patient doesn't feel listened to and heard from the primary care physician. Maybe that primary physician seeing 154 million patients per day because they have small reimbursement, and so they need to see 1 million patients to pay their bills. So it's just led to a negative feeling towards doctors from certain individuals, and they feel like they get the care and attention that they deserve from a chiropractor. There's also the hands-on nature of chiropractic. We are doing manual therapies with our hand. The word chiropractor, chiro means hand. Hand healer is the name of what that word chiropractic means. And so there's something special about human touch, about contact, where we're actually putting our hands on you and feeling what's wrong. And if a primary care doctor, or let's say an orthopedic doctor, you've got low back pain or you've got low maybe hip pain, and if you don't put your hands on the patient and you just order x-rays or you just order MRI, CT scan, and you haven't actually done a physical exam where that patient knows that you know what's going on with them, it's going to leave a bad taste in their mouth. So I think that's a little bit more of what has to do is chiropractors we're famous for our bedside manner. because we have to, because such a small percentage of people go to chiropractors that it's always been important to us to really connect and bond with our patients as we help them get out of pain and improve their overall health.
And you mentioned the path to becoming a chiropractor and certifications that you need and things like that. Are there certain personalities or types of people that are best suited for chiropractic?
Yeah, the odd duck. We have, chiropractors, we are alternative healthcare providers. So people that tend to be non-conventional tend to like going the chiropractic route. I know for me, the idea of being just like an insurance agent or an accountant or going to work for a corporate job always sounded so boring to me. And the idea of being a chiropractor where, you run your own business or you work in a small business, that sounds good to me. So I feel like a lot of chiropractors are the sort of people that like to be just a little bit different than mainstream, So that's what I see. Have you ever met any chiropractors other than myself?
I don't think I've actually been to a chiropractor myself, but
have you met any?
Not in person.
Well, I'm glad we could meet here. This is broadening your horizons. Good.
Yeah. I mean, and I feel like a lot of people maybe necessarily haven't, even in terms of being to one, or even in terms of assessing it as a career possibility, which is why, I wanted to do this to kind of give future healthcare professionals or people interested in a glimpse into chiropractic and the opportunities that they have in the field. So
that's great. That's great. I'm happy to be a part of this. There's no doubt in my mind that, one thing we deal with is I don't believe in chiropractic. That's what people will say to you. Maybe not directly to my face, but they'll say it behind my back or to other people that are considering going to chiropractors. And the thing is, it doesn't matter if you believe in it. We're manipulating a body part and giving neurological inhibition and altering the sensory motor control of an area. So whether you believe in that or whether you don't believe in that, it's still happening. And there's really a place out there to care for people, to be there for people, to help them get out of pain, to improve their overall physical health. There's such a need for that in our society. So anything I can do to help people find out about chiropractic, I'd love to do.
Okay, so any tips on getting into a competitive chiropractic school and maybe any kind of specialization program, if there are any that people are interested in?
There's really not that many chiropractic schools in the United States. There's probably 9 or 10. You want to make sure you touch base with them. You make it known to the school that you would like to be considered to be a candidate, and then they're just going to make sure that you have the you have the prerequisites: the physics 1 and 2, chemistry 1 and 2, organic chemistry 1 and 2, and whatever else has been added in the last few years to make sure you have those proper ones. There is an application process. But from what I'm aware of, I think it's a little bit easier to get into, say, chiropractic college than it is to go to maybe medical school or physical therapy school. I think it's a little bit easier. Where we kind of draw the line with our profession is the national boards. You have to know how to pass a pretty difficult test. And there's plenty of people that actually do make it through chiropractic school that never pass the boards and they end up never practicing. So that's kind of where the rate limiting factor is the national boards.
And what employment types or practice settings are available for chiropractors? It seems like most of them can practice in kind of a private practice outpatient setting. Are there any other settings that they work in?
Yeah, but not for the most part, you're spot on. Vast majority of chiropractic clinics are small clinics. Really, the sole practitioner, the one doctor office, still kind of reigns supreme in our field. I work in a bit of a bigger practice. There's 4 doctors, and we all share everything, and that's pretty nice. But, there is increasingly there's integrated practices. So maybe a chiropractor and a DC are working together. Maybe a PT is what I meant to say. Maybe a medical doctor, maybe a spinal surgeon. Maybe they have a chiropractor on staff. You do see that. It's pretty infrequent. The Veteran Affairs hospital system, they do have a number of chiropractors in their facilities. It's a small number, and we wish it would be a bigger number. We certainly, you're not going to find a chiropractor at a hospital. And that's something we'd really like to change going forward, because we know there are people we can help. And we know that lots of people don't like turning to drugs and surgery, for lack of better words, that we can help. That if we were in the hospital system, if we were affiliated with a bigger medical program, we could do a lot of good. So that's something we're looking to do increasingly going forward, is hospital-based systems.
How well are chiropractors compensated generally? And then what are ways that chiropractors could improve their income? Are there certain procedures that you do or things like that?
I don't know, probably not that great. I think that the amount of debt that we get into in school versus the compensation is pretty poor. And because of that, that is one of the things that leads to maybe abnormal practices, or kind of back to the conversation we were talking about, where chiropractors are doing treatments and frequency of visits that are a little bit unnecessary, because they might have some bills to pay, which is super unfortunate that is the case. Chiropractors, it depends. It's so unique, because in our field, we're all sole practitioners, or we're working in small offices. So, the guys that are really making a killing are the clinic owners. And then if they integrate and add medical services, the capabilities for reimbursement to rise are much higher. So you can make, multiple $100,000 per year. I would say the vast majority of chiropractors are making just south of 100K. And that's kind of their groove. So it's not the sort of, we're not getting super wealthy unless we've got a really great practice and we've been at it for 3 or 4 decades.
And what's the job outlook like?
It's good. It's strong, because it's all small businesses. So, anybody that believes in themselves and their ability to be effective in the world can graduate from chiropractic school and hang their shingle and open up their practice and start to make it work. It's, getting hired, getting a job in chiropractic is not that great, to be honest with you. The freedom and the better money comes when you own your own clinic. So that's why the vast majority of chiropractors are sole practitioners.
How grounded is the chiropractic philosophy in kind of evidence-based medicine versus maybe like anecdotal experiences?
Sure. Yeah. I will say it started completely anecdotal. Chiropractic started in 1895, and D.D. Palmer is the name of the guy that thought of it. And he was a goofball. I think he was a spiritualist and a energy healer and all sorts of stuff. And he actually had this, his janitor, Harvey Lillard was his name. I think Harvey Lillard was either deaf or he was blind. And he hadn't always been deaf or blind. Like, he'd just become deaf or blind within the last couple of weeks or months. And the one particular day, he's cleaning the office, and he's got a stiff back or something like that. And D.D. Palmer said, "Let me take a look at you." And he felt his spine, and he felt like, oh man, this vertebrae is protruding through his back. So he tried to push it back in, and it wouldn't go. So then he really, got some force into it, and there was a big crunch and crack, and it restored Harvey Lillard's ability to hear or see whatever one it was. And so then he started hypothesizing there must be something here. And as D.D. Palmer grew the professions in the early 1900s, he was really, I'm going to say, against the normal standardization and progression of evidence-based practices as other fields are, like osteopathy. That started A.T. Stills, not unlike the story I just told you, and they knew each other, and it was that same time frame. And I believe A.T. Stills was very much wanting to go the path of accreditation and crossing off the checks on the box that he had to get legitimacy into that profession. And chiropractic really resisted that. So the first half of the 1900s, it was lots of anecdotal evidence, lots of case studies, and overall, you would call this pretty poor evidence and research supporting what it is we do. The second half of the 1900s, we've improved upon that. I will tell you right now, to this day, we're still lagging behind your physical therapy and your mainstream medical professions, but we're getting a whole lot better. And we're starting to understand the evidence behind what we're doing and what we're not doing. And that's starting to direct and change our what we do. And, just like anything, as healthcare reforms going forward, we're understanding the need to be data-driven. And, I'm all excited because the last couple of weeks, I've got all these fun toys that measure my patient's physical condition with better specificity. I got a nice little digital inclinometer that measures the range of motion with great specificity of different body parts: your cervical spine, your thoracic spine, your lumbar spine, your hips, your knees, your everything. And we can now start using that to improve overall documentation, because the documentation for chiropractic has been generally poor over the history of our profession's lifespan. But we're improving on that. The research is showing that the spinal manipulation that we're doing, it does a great job at taking altered motor control and inhibiting that. And that's why you get the pain reduction and the improve of overall balance. And that gives us an opportunity to actually improve people's motor control, their posture, how they move and control their body. And we're finding that there really is something here that we do to people. And it's exciting to validate that and really get the evidence and support behind it that we've been lacking for 100 years here. So it's exciting going forward.
As healthcare professionals, there's often a lot of stress. How do you deal with the stress and prevent burnout and establish a work-life balance?
I watched the interview with the last guy, the physical therapist, and what did he say? He really likes to run, right? And that's how he likes to keep himself healthy and invigorated. And I'm the same deal. I'm a kettlebell guy, so I love working out with kettlebells. I've just like any person out there, I'm always striving to be a little bit healthier, get a little bit more sleep, remember to turn my brain off on the weekends and try not to think about the office and the patients and that sort of thing. But I think chiropractic, we certainly have our stresses, but I don't think they're any more or any less than any other professions. I know that for me, my favorite personal thing to do to prevent burnout is to make sure I have quarterly goals and tasks that I'm really looking to accomplish, because we're all going to get a little tired, a little burnt out, a little bored by our own experience of our own lives. And what I like about, it's January, 7th that we're sitting here recording this. I love the fact that January 1st, my wife and I and my partners at the chiropractic clinic, we got to sit down and make new goals. What do we want to accomplish this quarter? What did not work last quarter? And that sort of thing. On a personal basis, my sleep levels were terrible last quarter. I have a 1-year-old and a 3-year-old daughter, and they don't like to sleep through the night. So I have a Whoop wristwatch sort of thing that measures my overall sleep and my recovery. And I think my overall recovery levels were rated at 53% this past month, which is just, god awful. So my goal for this next quarter is to get 64% recovery. I think life is always much, much easier when we get enough sleep, when we get enough recovery. So not getting enough sleep is a great way to burn out and annoy yourself. I'm also looking at my weight and like I said, I really like kettlebells. This quarter, I want to get certified as a strong first kettlebell instructor. Not that I'm not a fitness professional, I'm a chiropractor, but that's just something that lights me up and gives me energy and excitement going forward. And it keeps me in shape, and it really is corrective for your posture and your movement of your body. So I think you got to focus on your own health, your own wellness, and go from there.
How has chiropractic changed since you started, and where do you see it going in the future?
Chiropractic, I think, is starting to get more mainstream acceptance. My wife is a plastic surgeon, so I deal with the whole mainstream medicine versus alternative medicine every single day. And the practice that she's in, the owner of that, he's a plastic surgeon, and he's the chief of staff for our local hospital. And getting to have a personal relationship with him, and over time, there's been moments when he questions chiropractic and our methods and our validity and all that sort of stuff. And then over time, he is more accepting, more inclusive, more understanding of chiropractic and whatever it is that's going on. He's got an L3, L4 disc bulge and then nerve root pinch and radiculopathy going on. And he's in so much pain that his buddy that gave him cortisone shots didn't alleviate it. His physical therapist buddy that gave him some exercises, that didn't relieve it. So what's next? He came over to have dinner with us the other night, and he asked for a treatment. So to have the chief of staff of a hospital, just whether he believes it or not, just the fact that he is open to getting a chiropractic treatment, that's great. So more inclusion into the hospital systems, more inclusion to insurance, reimbursement, and proper levels for that. That's the next step for us to go.
Building off of that, about chiropractic becoming more mainstream, it seems like chiropractic does really well on social media. Why do you think it's so popular, and why do adjustments get so many views on YouTube or TikTok or Instagram or things like that?
Well, because you can hear it. You can see it and hear the difference we're making. What I've noticed is for a while there, I was doing exercises on YouTube, and you just can't see the difference of exercise makes, can you? You can't visualize it. There is data that supports it, and it's awesome stuff. But for a viewer, it's not as entertaining. A chiropractic adjustment, you can hear it and you can see it, and then you kind of imagine what that would feel like. And that's not unlike, our pimple popper MD that, got all sorts of popularity. When you see a pimple pop and you think of the release and you imagine what it feels like, there's something satisfying to that experience. I said, my wife's a plastic surgeon. Some of the plastic surgeons on social media show the procedures of a breast implant going into a breast and then taking it out. And it's so weird, but there's something satisfying about seeing that happen. So I think chiropractors are inherently entrepreneurial because we have to be, because we don't have that mainstream acceptance. So social media, the world is changing, and chiropractors are looking for the next way to promote their practice, their services, so that they can help other people. And right now, YouTube, Instagram, TikTok, you name it, Twitter, those are the most effective ways to do that. So we are quicker to try stuff like that out versus our mainstream medical counterparts, just because we have to.
And since you built a pretty large following online on like YouTube and things like that, what tips would you give for like new chiropractors to do well on social media?
Concern yourself with the quality of audio, the quality of light, and the quality of your video making, which, I know I go through times when I think, I'm a chiropractor. What the heck am I doing editing videos and learning how to do the next microphone, the next sort of lighting, all this movie making skill stuff that I've immersed myself in and understood what is my audience really looking for, and how can I give that to them while at the same time doing what I really want to do, which is talking about the difference that chiropractic can make. So it's this marriage that you're always kind of finding out, do I want to do that? Do I want to lean towards that? If it's just talking about the stuff I want to talk about, it's not terribly exciting. But if I do a crack of somebody's neck and the microphone's right on it and it's an attractive girl, oh, now we got millions and millions of views. So finding the right marriage between effectiveness and what it is we're looking to say is what you want to do. And then there's just the consistency thing, and you're doing it with your YouTube page here. Keep pumping out materials. Get better at it. Your first 45 times are going to be terrible, but you're going to figure out a groove. You're going to figure out what your audience really wants to hear, and how is that in line with what your message and what you really want to be saying, and what are your capabilities for actually getting it out there.
In chiropractic versus any other healthcare professional, you're always trying to help promote positive behavioral changes in your patients. What are tips or techniques that you've learned to help with promoting those positive behavioral changes in your patients?
I think there's two things that people really need to do in life. Number one, you got to work out. You got to have some sort of physical activity that is so common in your life that it's routine. So, I remember my grandfather was in the Air Force, and he would wake up and he had a 5 or 10 minute routine where he was doing sit-ups and push-ups and this and that. And, he lasted till he was 92. It was awesome. So a routine of physical exercise, of physical movement, whether it's hiking or whatever, something needs to help you support structure and stability going forward in your life. Because, we all learn about entropy. We're all turning to chaos and disorder one day at a time. We're all going to be dust in the ground one day. So what actions are we taking on an ongoing basis to support structure, stability, and order in our lives? And strength training, whether it's swinging a kettlebell, lifting a weight, doing Pilates, doing some yoga, are all great examples of what you can do to help maintain and support your body going forward. And number two, people these days are not cooking at home, learning how to cook. It's so much easier to be healthy, to be in shape when you're cooking at home, and people are really relying on eating out, ordering out, meal deliveries, all that sort of thing, which none of that's doesn't have the potential of being as healthy as you cooking at home. So I think it's important for people to cook at home. But, one thing I want to say is chiropractic, some people believe in it, some people don't believe in it, some people, it gets a bad rap sometimes. But all I know is, back to my Hoar family story, we're all breaking down, and spinal issues are such a common thing in our society. 2 of my extended family members had spinal surgery this year. The first one was in February. She was not a particularly healthy person. She didn't exercise. I don't know if she cooked at home. She had her spinal surgery. 4 days later, she's sitting on her couch. She's in recovery, and she had an embolism and bled out, and she died. Oh. She's 60 years old. To die from a spinal surgeon is a travesty. And then later this month, later in the year, my uncle, who's probably, I don't know, 62, 63, something like that, he goes and has spinal surgery. Well, it wasn't a great success. He got hooked on pills after that. He's now, as we're sitting here recording this, he's in drug rehab. This is one of the healthiest guys I've ever met that wouldn't touch pills ever, but he's in so much pain from this spinal situation that he decides he needs surgery, and boom, he ends up in addictive rehab. It's a terrible, terrible thing. Spinal pain can be so debilitating. So when there are people out there that can do something like a spinal manipulation, some exercises, some massage that actually make a difference where you don't have to turn to drugs, you don't have to turn to surgery, I'm all for it. And I think we need to be doing more of it going forward.
How do you become a good chiropractor or other healthcare professional? Any final advice?
Well, I think it's like anything. You follow the data. If you're keeping good notes, keeping good records, you're doing outcome assessments, and you see what really makes the difference, and be willing to go take some courses. Be willing to fly to Jacksonville, Florida to spend a weekend learning about blood flow restriction therapy. Be willing to learn about, functional movement, the selective functional movement assessment, and active release technique, and the new one, Andrea Spina's, he does functional range release. So take courses, go beyond what you have to take due to your state laws, and take the fun ones. And I know when I was setting my goals for this quarter, I really need to find a new fun certification so I can broaden my horizons. And not only will it be more exciting to me, but it's going to make a bigger difference for my patients and become the good chiropractor like you just mentioned.
Well, thank you so much, Dr. Hoar, for being a part of this interview. Thank you, everyone who watched. Feel free to write comments down below, and I'll ask Dr. Hoar, and he can be reached again at mobility-forlife.com. Thank you guys so much for watching, and hope you guys have a great day. Take care.